We call it convalescent plasma therapy. No? So, ang kinukuha po namin, first of all, we identify COVID-19 survivors. And when we say COVID-19 survivors, nagkaroon po sila ng COVID-19 as confirmed by a positive PCR test. That's the first requirement. And then they recovered, and then they have a negative PCR test. So, confirmed to be positive and then became negative. So that's
Okay.
the first thing.
So let's be clear about that, Doc Jonas, because meron tayong mga pinag-uusapan na nagkaroon ng COVID-19, na-hospital, gumaling. Ito yung mga survivors. Meron naman yung mga asymptomatic, yung mga wala silang manifestation pero carrier sila. Yung bang carrier pwede magbigay ng plasma o hindi?
Pwede po, basta it doesn't matter whether you became critically ill, whether you got hospitalized, or you are like a walking carrier of COVID-19. No? All of those people, different presentations, but all of them got COVID-19 disease.
Okay.
And then they all will recover in their blood, specifically in their plasma. They carry antibodies against that virus that caused COVID-19, specifically the novel coronavirus. No? So it's very specific for that virus. So we now take advantage of that because these survivors or those who had recovered from the illness carry these antibodies, which can actually help another one who hasn't really gotten off the disease. So lumalaban pa. Kaya we ask these people to donate their blood. We actually segregate and separate their plasma, which is the liquid part of the blood, and then we transfuse this plasma to a patient who is critically ill, and we're hoping with those antibodies that are in the plasma of the donor, that will help the recipient.
How particular are you sa screening ng mga donors?
That's right, Sito. We have to make sure that the blood that we are getting will be coming from healthy donors, right? So merong criteria. So we actually the first screening is to make sure that they got a confirmed disease and then they recovered with a negative test. Second is they should manifest 2 weeks of being symptom free. Talagang wala nang nararamdaman, malakas na sila for 2 weeks after that negative test. So after the negative test, we count and we ask the patient, how is he for 2 weeks? Dapat walang symptoms, feeling well, fully recovered as verified by a physician. So then we also do the regular screening that every blood donation center does anyway. So there will be questionnaires, and then we will take a sample of their blood because we need to make sure that they do not have other diseases, especially blood-borne infections, hepatitis, HIV, etc., etc. So only when they pass the initial screening will they actually be able to come to us and donate.
Yeah, I'm wondering about that, Dr. Jonas, because we understand yung carrier of blood-borne diseases. Now, many of the victims, from what I've heard globally, are diabetics. And I know from mga blood donations, if you're diabetic, sorry, no-go ka. You can't donate. So does the standard rules apply that whatever the rules are for blood donation that bans people who are diabetic, etc., apply also with this plasma donation?
Yes, more or less, Sito. So because we also, this is basically a blood donation. So the standard screening or inclusion criteria, exclusion criteria being used in blood donation will also apply. Now, with regard to diabetes, marami talagang diabetic na pasyente. What I was told was it's a no-no if you are taking insulin. Okay, but if you probably have mild diabetes and it's controlled and you're only taking an oral medicine, baka pumasa pa, no? But in general, really, we would like to exclude patients who have heart diseases, diabetes, cancer, or some other illnesses wherein they're taking so many maintenance medications.